We Europeans are living longer and healthier lives, which is a good thing. But living longer can also mean living longer with a chronic condition. This creates a huge challenge for the healthcare systems across Europe, with more people having to live with lifestyle diseases for an increased number of years. The task at hand is how to deal with an increased need for care to help people live a healthy life. Patient empowerment is one of the key solutions to this challenge. People living with chronic conditions are both able and ready to work with healthcare professionals in managing treatment and care. Given the right information and support, individuals and families can successfully monitor and manage chronic conditions, making life better for themselves and easier for the healthcare system. That's what we call patient empowerment. It would, of course, be terrific if everybody could live happily with lifestyle diseases like diabetes, COPD and heart disease, administrating their medication and monitoring their own disease. But that is not enough. To live a better life, people living with chronic conditions have to fundamentally change their lifestyles. For instance, what they eat and how much they exercise. And we all know from experience how challenging lifestyle changes can be. Research shows that the healthcare system, along with family, friends, fellow patients and the local community, can be crucial in making lifestyle changes a success. By providing relevant information and treatment, and by supporting people with chronic diseases in learning new tools to handle their everyday life, progress can be made. If healthcare is a dialogue and partnership between both professionals and people living with chronic conditions, everybody will be motivated to change things for the better, empowering individuals and the system alike. In the long run, patient empowerment is an excellent way to help people with chronic conditions take more responsibility for their own life and health. But for the empowerment to succeed, some major changes have to be made. The healthcare system must create a patient-centered culture, in which patients are informed and involved in all phases of their treatment. People living with chronic diseases must then be supported in making decisions regarding the treatment. The job of the healthcare professional is to inspire, support and help, but not push. There are many ways to help and support, and the challenge is to combine the best solutions for each individual. This way, the individual formulates his or her own goals, thus creating commitment and empowerment. Empowerment spreads. As healthcare professionals become better at supporting their patients with making decisions and handling their chronic disease, more professionals and more patients will feel empowered. Thus, more people with chronic conditions will experience that they themselves can take actions that will give them not just a longer, but also a remarkably better life.